This week, Pfizer announced it would submit its data on 5 to 11-year-olds and the effect of the COVID-19 vaccine on that age group. It is another step toward making the shots available to younger children. While it's a new vaccine, other vaccinations are nothing new to Minnesota students.
They're already required to get several other shots. Today, a group called PICA organized a clinic to help make sure that kids don't fall behind during the pandemic. Families could head to the Fraser Center in Minneapolis to get up to date on shots for things like hepatitis and measles. So how does a vaccine become a requirement for Minnesota school kids? Good question. Here's Heather Brown.
If you're a kindergartner in Minnesota, you've already had quite a few shots. Then around 7th grade, add in the one for meningitis. Of course, there are exemptions for medical and non-medical reasons, but about 90% of Minnesota kids have had these vaccines. So how did that come about? Well, school vaccination laws date back to the 1850s when Massachusetts wanted to prevent smallpox. But it wasn't until the 60s here in Minnesota that the requirements for children were put into law. Back then, it had to be passed by the state legislature. That's how we got measles in '67, rubella in '73, and more. But by the time the state added chickenpox in 2003, the law had changed. The legislature can still add a vaccine, but now the state's Department of Health has the authority to create policy to be able to carry out our state's vaccination law. That means MDH can make a change too. It's a long process, 12 to 18 months. First, MDH publishes a notice to tell people what's happening. They ask for comments. They have a hearing. This is one from 2013 when the meningococcal vaccine was added. Then there's a statement where MDH has to prove what it's asking is necessary and reasonable. How do you decide which vaccine to include?
We look at the epidemiology of the disease, the morbidity and mortality rates from the disease, the safety and effectiveness of the vaccine, cost. There's a range of things that we look at.
Is the vaccine licensed? Has it been recommended for children by the CDC? Is school a primary route of transmission? That's part of the reason HPV is sexually transmitted disease. The vaccine for that isn't required. And as for flu, Airsman told me that it'd be hard to implement that one because you need to give it every year. Would you anticipate 2-3 years down the road that COVID would be a required vaccine for kids here in Minnesota?
Man, my crystal ball has not been very good over the last couple of years, but certainly I think that COVID has been an illness that's been significant in this population, at least in terms of illnesses. And so I think it's something that we would be looking at and evaluating.
Legislative leaders told me that there's no plan to bring up the COVID vaccine right now. Heather Brown, WCCO 4 News.
Chris Airsman tells Heather while she appreciates a thorough process to include a vaccine into state law, she doesn't want parents to feel like they have to wait for that.
She says the COVID vaccine is safe and effective and recommends taking it as soon as it becomes available to your child. If you have a good question for Heather, email her through WCCO.com/links.